Hi and welcome. I'm trying to learn medicine, today anxiety, and after we've done what we're gonna do, shoulder impingement training. And if you participate in shoulder impingement training, then it's at your own risk. And we're talking here about psychological things, so anxiety, and medical things. And this is no medical advice, we're just reading about it, and that is part 2. Now we want to go on with the symptoms. Symptoms of anxiety: listlessness, weakness, and fatigue. I don't know what listlessness is, but weakness and fatigue also, together with anxiety. And also headaches and head pressures. Okay, people have headaches sometimes and head pressures. And again, that book is from the 80s, so maybe some things are more known. We're seeing here at one place, doctors are only beginning to understand how anxiety about everyday life can cause the physical symptoms described below. So we're saying here, this is something complex, which we don't completely understand at the point where that book was written. So listlessness, fatigue, and headache, weakness, and then also tenseness, nervousness, and irritability, and depression, usually at night. That is an interesting, what she's saying at night. Okay, the next thing, unexplained pains in any part of the body, but particularly in the chest, abdomen, and back. Dizzy spells. I don't know what it is. What's dizzy spells? Okay. Dizzy spells. Deep sighing breaths. So people making deep sighing breaths. Panic or palpitations. I still don't know what palpitations are, but now together written with panic, I have a little idea. Maybe. Nausea, vomiting, diarrhea, and frequent passing of urine also. And insomnia. Duration. The symptoms tend to come and go as long as the person has cause to be anxious, but they do not usually get progressively worse in either frequency or severity. Okay, the people basically have the symptoms as long as they have the anxiety, but they don't usually get worse. Causes. There are as many causes as there are challenges which affect people. Conflicts, especially of loyalty, are particularly able to produce symptoms of anxiety. Both doctors and patients tend to describe these challenges and conflicts loosely as stress. That is interesting. They're saying what a lot of people declaring to be stress are then conflicts, oftentimes about loyalty of one person to another, or company or whatever. That is interesting. So people saying stress, but they mean oftentimes conflicts about loyalty, or that their loyalty is not as good as they hoped it to be or as it should be. Complications. Some people are especially liable to develop symptoms of anxiety over many years, the so-called chronic anxiety. Okay, some people have more to right here. Treatment in the home. Anyone helping to deal with long-standing anxiety symptoms in a friend or relative has the difficult task of encouraging the sufferer to undertake the maximum of productive activity and the minimum of introspection. Okay, the next sentence. Being oversympathetic on the one hand, or telling the sufferer on the other to pull him or herself together, or that his or her symptoms are imagined, is liable to aggravate the condition rather than improve it. So in the first part they're saying that they should try to be productive and active, doing things. Whether they are working or entertainment or whatever, doing active things, they are saying, and not to be introspective. I think they mean thinking, or to be bored and thinking around. But also to state here very clearly, even more than an idea to help, that being oversympathetic is not good, and also to tell the person that they should just ignore it or pull themselves together or whatever, that is aggravating it. Then to consult the doctor. Symptoms which could be due to anxiety are best reported to the doctor as soon as possible for 2 reasons. Firstly, they may be caused by a serious disease and not by anxiety at all. Secondly, if a doctor can reassure you early on about the cause of the symptoms, it will help to prevent the vicious circle of chronic anxiety from developing. Okay, we're saying that anxiety is often, as we said in the first part, is oftentimes about things that we don't really know what causes the fear or the anxiety, the state of being anxious. If it is a very eminent fear facing a crocodile, a lion, a predator, wild animal, or having, they also said, an exam or a test or an interview, a job interview, then the people understand it is because I have tomorrow or today or an hour an interview or presentation or whatever. When they know that they are because of that anxiety, anxious, but it goes run away. And we're now saying here that anxiety is often about things when we don't know where it comes from. So we don't know that they are anxious because they had a dispute the day before, because someone isn't loyal to them a day or a week before, or because people are worried about their child or about their money or their job. So basically we're saying here that this idea here from the 80s, maybe it is a bit better research now, but it is oftentimes about not knowing what causes the problem. And worrying now about what problem is then the vicious cycle. So the people worry now why they are anxious, and they're now anxious because they're anxious, and so on goes on. Now the idea is then here, go as soon as possible to a doctor, so that it is found out, firstly, if it is maybe just a disease somewhere. That doesn't have to be just, so it's not better. And also then that the person maybe finds out why they're anxious and don't get into the vicious cycle of being anxious because of being anxious. I think that is the main reason why we're saying be productive and do activities, whatever it is, and don't think too much, because their main idea here in the 80s at that point is if you get worried about being worried, so do something else. Do entertainment, work, be productive, accomplish something, or just have fun, but don't worry, basically. Worry about being worried. Maybe the anxiousness goes when just away. What the doctor might do: find out your medical history and examine you in. So we're talking now suddenly in you. I don't really know how I want to do it if I want to interpret the sentence here, but that part is written differently from the other one in this book a little bit. And also here, with saying you, they don't usually do it. Find out what the doctor is doing, find out the patient's medical history, and examine the patients in order to exclude the possibility of serious diseases. So we're looking if there's maybe a serious disease somewhere. Explore those areas of the patient's life which involve challenge, conflict, and worry. Okay, we're looking, is there maybe something, a dispute, a conflict, a worry going on, which is maybe the cause of the anxiety. These may include sexual and family relationship, finance, and jobs. So some things where people might not have the most easy life. Discuss conflicting challenges. This often helps individuals to put their worries into perspective. So we're saying no, the idea is now here, with the doctor, with the person who knows how it works, to discuss the problems properly, so not just thinking about them and getting into a vicious cycle, but properly to talk about them, to find out maybe they are anxious because they don't have enough money, or they're anxious because they have another disease which makes them anxious, because they can't accomplish their goals or whatever. And that they can then really see that they may be anxious because they haven't got the promotion in their work. And then that they can see that is why I'm anxious. And maybe that happened. Explain the nature and causes of the symptoms of anxiety. This may help the individual to see wider problems. If this is done with understanding, the symptoms may gradually disappear. So we're saying they are battling here the vicious cycle by saying the person doesn't know why a person is anxious, and that is their approach. And by knowing that it is maybe because they don't know what they're anxious about, and finding out what makes sense, and maybe removing that problem even to get it or solving it, maybe also help. And to know where it comes from helps. Prescribe a tranquilizer, sedative or mild painkiller to help break the vicious cycle of worry. These drugs should never be seen as a long-term solution, however. Okay, we're seeing here that there's also the idea of some medication, but they are not as a long-term solution. Send the sufferer to a psychiatrist if a condition is extreme and is persistently preventing the sufferer from functioning normally or forming proper relationships. Prevention. Anxiety helps most of human beings to face the challenges of life successfully. Usually, all that human beings need to do is to recognize it and to manage their reactions to it. Perhaps the best prevention is the full enjoyment of relationship with our family and friends. Yes, it is completely different written than the other articles, but it's also more personal here written. So basically, that gives me the indication that this is not completely, that this is also the personal ideas of the author of the books, that authors best try to help, what the best ideas are. And the final tip is basically to enjoy relationships with family and friends. Hopefully they are not the cause of anxiety. Okay, basically they said here now that anxiety, they said within the introduction, that anxiety is a normal reaction to difficult tasks or some things. And by facing these challenges and by understanding them, overcoming them, some anxieties go away. Outlook. In a few people, the vicious circle of chronic anxiety may persist for years. The majority, however, eventually come to terms with their symptoms and manage to live relatively normal lives as they develop rewarding relationships. Now again, it seems to be a little bit of a personal view. It could be also that is a normal part of life story. We are saying our rewarding relationships, maybe we're adding here that maybe a lot of things had to do with loyalty, and that has a lot to do with the people are around them, but they have now their own family or new friends and so on. So basically, facing the problems, do they say, and understanding where it comes from, finding out what causes the anxiety, solving it, overcoming it, or getting rid of that problem, and trying to be active and try to have relationships, proper relationships. Now, that was the medical part. If you were here for anxiety, for medical part, this was now medical advice. I just read about it in this book. If you were here for medicine, you can go directly to the next part of medicine. If you were here for medicine, we will talk about something in medicine. If you stay here and participate in I forgot it. The shoulder impingement training. If you stay and participate in the shoulder impingement training, then it's very honest. Having a good stable standing stance, and we do the shoulder stretch. Back, up, in front, and down. And front, up, back, and front, up, back, and now long arms with strong fists. Go as far back as you can with the shoulders. High up, and front, and down. Again back, up, and front, and down. Again up, back, down, front, up, back. And now, long arms, strong fists, bring the shoulders down, hands together, and press the shoulders into the rib cage. So not just down and together, but into the rib cage. Try to bring it into the rib cage. Down and together with the shoulder blades, and turn the arms to the inside. Arms to the outside, shoulders down and together, press them to the rib cage. Turn the arms to the outside. Again to the inside with the arms, shoulders down and together. And to the outside. Down and release, and arms to the side, a bit in front, turn them in front, shoulders down and together, press them into the rib cage, turn the arms in front. Arms back, shoulders up and in front, and arms in front, down and together, arms back, shoulders up and in front. And gradually release. And now a shrug. Lift the arms up, shrug the shoulders up, and release all down. And again, arms up, shoulders up, and all down. And the last time. Now the pretzel, arms together, down into the outside. And now the sunlight. You can use a soccer t-shirt, so if you guys have the long arm at the outside, let it fall down and try to catch it again. And on the outside. And now the elephant trunk. Stop stretching. One arm in front, the shoulders back and down. Pull the arm in, have flat fingers, try to relax the arm, go with back with the shoulder. Turn the palm up to the sky. And the other arm in front. back and down, pull the arm and have flat fingers. Try to relax the arm, cover it back with the shoulder, and turn the palm to the sky. And that was the short and pitch. Thank you very much, and until next time.